Eczema Relief Cream is used to moisturize and treat dry, rough, scaly, itchy skin, and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, reducing itching and flaking. Some products are also used to protect the skin from irritation, such as from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and this cream works by forming an oily layer on top of the skin that traps water in the skin. It contains common emollients such as petrolatum, lanolin, mineral oil, and dimethicone, as well as humectants like glycerin, lecithin, and propylene glycol to draw water into the outer layer of the skin. Additionally, it includes ingredients to soften the top layer of skin cells and help the skin keep in more water, leaving the skin feeling smoother and softer. Make sure to use this eczema relief cream as directed. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of your skin as needed, or as directed by your doctor. The frequency of application will depend on your specific skin condition and the product you are using. For dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you are using this cream for diaper rash, make sure to clean the diaper area well before applying the cream. If you are using it for radiation skin burns, check with radiation personnel before applying the cream. Be sure to follow all the directions on the label for proper use and only apply the cream to the skin. Avoid applying the cream to sensitive areas such as your eyes, mouth, nose, and vaginal/groin area, unless directed by your doctor. If you have any questions or concerns, consult your doctor or pharmacist for more details. Use the cream regularly as instructed to get the most benefit from it. Apply the cream after bathing or showering while your skin is still damp. For very dry skin, your doctor may recommend soaking the area before using the cream. Be cautious of long, hot, or frequent bathing, as this can worsen dry skin. If your condition persists or gets worse, seek medical help right away. When using eczema relief cream, it is important to be aware of any potential side effects. While most emollients can be used safely and effectively with no side effects, some people may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to notify your doctor or pharmacist. If your doctor has prescribed this medication, it is because they have determined that the benefits outweigh the potential risks of side effects. It is important to note that many people using this medication do not experience any serious side effects. However, it is crucial to seek medical attention if you notice any unusual changes in your skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. It is important to keep in mind that this is not a complete list of possible side effects, so if you notice any other effects that are not mentioned here, it is advisable to contact your doctor or pharmacist for further guidance. Additionally, in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before using this eczema relief cream, make sure to inform your doctor or pharmacist about any allergies you have to its ingredients or any other allergies you may have. It's important to also consult with your doctor or pharmacist if you have any skin cuts, infections, or sores before using this product. Some ingredients in the cream, such as preservatives or fragrance, may make your skin more sensitive to the sun. Be sure to read the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. If you are prone to acne breakouts, look for the word non-comedogenic on the label to ensure that the product will not clog your pores. Also, be aware that some products may stain or discolor clothing. It's best to ask your doctor or pharmacist for more details. Before undergoing any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, be sure to tell your doctor before using this product. Additionally, if you are applying this cream to the breast area, consult your doctor before breastfeeding, as it is unknown if this product passes into breast milk. When using eczema relief cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. It's important to follow their instructions closely for the best results. If this cream is accidentally swallowed, it could be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help immediately. In the US, you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. To prevent dry skin, it's best to use lukewarm water when bathing, take baths or showers less often, keep baths or showers short, and use a humidifier when the air is very dry. Eczema relief cream comes in various forms such as oils, creams, lotions, or sprays. It's important to consult with your doctor or pharmacist to determine the best product for you, especially if you have sensitivities to fragrance or other ingredients. Remember to use the cream as directed and apply it to the affected areas of your skin. If you forget to use this cream at your regular time, apply it as soon as you remember. Do not apply extra cream or use it more frequently than directed. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep the cream away from children and pets and do not store it near high heat or open flame. Since the cream is under pressure, do not puncture or burn the canister. Do not flush the cream down the toilet or pour it into a drain unless instructed to do so. Properly discard the cream when it is expired or no longer needed. Consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.